Hello, everyone. This is Dr. Hassaballa, uh, coming to you with another episode of the Healthcare Musings podcast. I'm very happy to have you with me. Continuing on the series of denials from the appeals desk to explain the different types of denials that insurance companies can issue and how to deal with them. This one is perhaps the most frustrating and annoying with which I need to deal as a physician advisor and appeal letter writer. This is called the 30-day readmission denial. Now, just to give you context, the Center for Medicare and Medicaid Services, otherwise known as CMS, penalizes hospitals for excess readmissions within 30 days. The program is called the Hospital Readmission Reduction Program. Okay, and what it does is it tracks the ratio of predicted to observed readmissions to the hospital for 6 or 7 conditions. Number 1, acute myocardial infarction. Number 2, chronic obstructive pulmonary disease. Number 3, acute heart failure. Number 4, pneumonia. Number 5, coronary artery bypass surgery. And number 6, elective total hip surgery. And number 7, elective total knee surgery. So if there are excessive readmissions to the hospital for patients with any of these conditions, then the subsequent year payments to that hospital are reduced. So CMS does this program to, and I quote, encourage hospitals to improve communication and care coordination to better engage patients and caregivers in discharge plans and in turn reduce avoidable readmissions. And they do this, unquote. They do this because obviously being readmitted to the hospital costs the program extra money. And if there is something that the hospital is doing wrong, or they're not coordinating, or they're not communicating appropriately, then the hospital, in CMS's eyes, deserves to be penalized. Now, commercial insurance companies take this, arguably laudable program and extrapolate it to their own cases. So what they'll do is they will, you have an admission, for example, for pneumonia. Okay, patient gets admitted to the hospital, they get treated, and they get discharged. And it's a rock solid case of inpatient level of care, which pays higher, and everything is done fine. 3 weeks later, they get into a car accident and they're admitted for surgery related to the car accident. The insurance company, the commercial insurance company, will then go and deny the second hospitalization because it, quote, occurred within 30 days of the previous hospitalization, unquote, even though it has nothing to do with the previous hospital stay. I mean, I've seen this denial come through, even if it's like 21 days or 25 days later, they will come and deny the second hospital stay, even if that second hospital stay has absolutely nothing to do with the first. And a lot of times I've noticed that this will come through when the second hospital stay is super complicated. The patient goes on a ventilator, for example, they're in the ICU for several days, then they're out of the ICU on the floor, and multiple things happen. So the hospital will just say, oh, look, they were admitted within 30 days of a previous hospital stay. We're going to combine the two and deny the care. And, it's so annoying. It's so frustrating because now you have to go and argue that this had nothing to do with the first and show that the first hospital stay was even for a different diagnosis. And the second hospital, I mean, it's one thing if it's the exact same diagnosis within a couple of days of one another. Okay, that kind of makes sense. But if you have one hospital stay for pneumonia, for example, and then the second hospital stay, they come back with a heart attack, right? Or they have a car accident or something like that, or cardiac arrest that has nothing to do with the first, it's very difficult to justify this kind of denial. It seems to be very cynical and just a way for the insurance company rather to deny payment to the hospital, delay payment to the hospital to maximize their profits, right? And it's so annoying. It's so frustrating. And not only punitive, and it's very punitive and wholly unnecessary. It's one thing. I understand what CMS wants to do. It wants to improve quality for Medicare beneficiaries. This kind of denial is just obnoxious, and it's so difficult to stay calm when you have to write the denial letter, or the appeal letter rather, to appeal this kind of denial. It really has no explanation, and it has nothing to do with the CMS program. And I wish commercial insurance companies would stop doing these kind of denials. That said, they are a fact of life, and unfortunately, I don't think we're going to stop seeing these kind of denials come through, especially now in 2024, like we talked about last time, that Medicare Advantage, commercial Medicare Advantage plans are mandated to follow the 2-midnight rule. So they're going to have to be paying for way more inpatient stays because of this rule, and I'm so happy about it, the rule, and just expect to see more and more of the kinds of obnoxious denials like this one, the 30-day readmission denial, which is very callous, very arbitrary, and very annoying. And I wish that I really do. They wish they would go away. Thanks so much for your time and attention. This is Dr. Hassaballa for the Healthcare Musings podcast. Until next time.